Social media can be a really powerful tool when it comes to raising awareness about issues in the community.
That's why our next guests are taking to the internet to open up a conversation and educate the public on topics like sexual assault, human trafficking, and domestic violence.
Yeah, welcome Jen Tran, coordinator of the Methodist Hospital SANE program. First describe, because it's a SANESART program, describe what that is.
Right. So SANE stands for Sexual Assault Nurse Examiner. We're part of a sexual assault response team. We started our program in 2003, so we're the longest running program in Omaha. We are the specialists in the care, treatment, and evidence collection of survivors of domestic violence and sexual assault and human trafficking.
So break that down a little bit more for us. Who comes to you for help and how do you help them?
Sure. So survivors, whether they call police or they know that they need medical help, can come into Methodist. And then we're activated. So we work 24 hours a day, 7 days a week, 365 days a year. We come in and help them care for their injuries, document their injuries. If they want evidence collected, we'll collect evidence for them and then turn that over to law enforcement so it can be prosecuted.
Yeah, you mentioned 365 days a year. You guys are always ready, but how prevalent are these incidents? And I'm talking about sexual assault, domestic violence, and then human trafficking is one of those issues that is kind of at the forefront a little more than it has been in the past.
Very much so. So when we started our program in 2003, we saw 27 patients. And now on average, we see over 300 a year.
Oh,
and
wow.
that's all combined of those populations.
Is it just more people knowing about the resources, or is it just more human trafficking going on?
I think knowing the resources and being willing to talk about it, and I think that's why our Twitter chat is so helpful, is that now we have a platform that we can start talking.
Well, let's get to that.
Okay.
It's the 6th annual Twitter chat, and it is tomorrow. Explain exactly what's happening tomorrow on Twitter.
Okay, so each year we get community experts together, and they participate both virtually and live at Methodist Hospital. And Methodist asks a question during a live hour between 12 and 1 tomorrow. And then those community experts will respond to those questions to give resources and information and support to the community. And then the community can get involved because they can also ask questions, and then we can find some answers for them.
I don't want to put you on the spot, but what's an example of a question that might be thrown out there initially on social media? I don't know if you're involved with the content of that, but
yeah, definitely. We really want to focus on start by believing. That's one of the hashtags that's kind of become popular today, where why are we blaming the victim? Let's talk about what happened to them. And then also consent. What's consent? It's not just the absence of no, but actually being an active participant in encounters.
And who are the community partners that are involved that will be on there as well?
So our SANE nurses will be there. We have people from the Attorney General's office, from the county attorney, law enforcement, advocates from the Women's Center for Advancement, the Women's Fund of Omaha. So lots of experts in the area.
Yeah, there's a lot of groups involved in this. Yeah, a lot of groups involved. Okay, so this is all going to kick off tomorrow. You want people to participate in this?
Yes.
Men, women, students. How do you want them to take part?
So if they follow at Methodist Health on Twitter, that will be where the questions and hopefully the answers come from. And then just ask questions and participate, retweet if something moves you, that you see something that you think awareness needs to be made, then retweet and pass the information along. We were just saying that one of our employees saw a tweet from last year that came back around right now. So has it been floating around this whole time, or you know, where did it come from? So.
Well, since it's in the 6th year, obviously it's gained attention around the community. And why do you think that Twitter is such a great way to raise awareness? Our target population, we know that they're in social media, so we want to meet them where they're at and have that discussion, especially with the Me Too movement. We're talking, so let's have a very informed conversation. Yes.
Okay, well, let's get to the hashtag, because the hashtag is important. So you can link to it, you can find the discussion, and follow along with that dialogue. What is the hashtag this year?
Hashtag is #no more.
Hashtag no more.
Yes.
You can get involved in that Methodist SANESART Twitter chat tomorrow, again starting at noon on Twitter. Follow Methodist Health, and the hashtag once again is no more.
Yeah, hashtag no more. How much of a discussion does this spark under specific tweets you may have? I mean, how much traffic does this generate? Have you been able to kind of track that?
It's been pretty impressive, and they were just saying that while last year we had a really busy hour, the time following, the immediate time following was huge.
Right.
Yeah, makes sense.
Well, bestcare.org/support for more information on the program.
And look for that hashtag, no more, tomorrow, all day. We're starting at what time?
12 o'clock.
Okay, thanks a lot. Thanks for coming.
Thanks for having me.